The whole world, with millions of people around the globe who had no idea what is coming, with no preparation or a proper healthcare system to contain the unexpected disaster that would change the world as we know it.
They're fighting a war here and they're losing. The sheer numbers of people succumbing to the coronavirus is overwhelming every hospital in northern Italy. The staff are working flat out trying to keep these people from deteriorating further. They're trying to stop them from dying.
So, what is the problem? The pandemic situation of COVID-19 drove to a huge concern about the gap in the current healthcare system that the world has just realized. Challenges are not only found in the medical resources, but also found in the system itself for handling unexpected patient demands. In some places, it's becoming the matter of deciding who's going to live and who's going to die. This could have been avoided by a better healthcare system, which has been always pulled by two main requirements. First, the need to sustain an increased demand, and the second, the need to lower the costs of healthcare services. So, is there a solution? Well, the solution that we provide is based on research papers that have found that COVID-19 stage can be diagnosed using tongue features with a very specific, rare and labeled dataset by professionals. With other researches as evidence that mobile phone cameras are reliable to take tongue picture images for automatic diagnosis by artificial intelligence, we are just glad to present you iDiagnose, a telemedicine application for diseases diagnosis. So, how does it work? Well, the answer to that question takes us back to 2630 BC, when ancient Egyptians just took the first step of medical diagnosing through observation and inspection. Jumping forward in time and heading east, during 475 and 221 BC in China. The changes of the social system led to many advancements in sciences, which included medicine and became more familiar as traditional Chinese medicine. In traditional Chinese medicine, it has been said that the tongue is the door to the heart, which implied on how the observation of the tongue can lead to early diagnosis for diseases or even monitoring a current disease. Now, let's come back to the future. The development of the current technologies of computing and artificial intelligence enabled machines to have something very precise, even more precise than human eyes, and absolutely subjective more than a court judge. Color segmentation algorithms gave the opportunity for an accurate acquisition of a pre-specified attributes in a picture that might not be very clear with human eyes in certain conditions. With these supervised and unsupervised machine learning techniques, iDiagnose run a machine learning training model to classify the existence or the stage of a disease just throughout an acquired image. By iDiagnose, the risk is instantly classified.